through a quick presentation here of basically an intro's guide to Medicare in Wisconsin because we are pretty unique. First thing, here's a copy of my insurance license. I just didn't start doing this yesterday. As you can see by the red arrow, I've been licensed since 2009, so more than 10 years. Do you need to enroll in Medicare? This is one of the first questions that comes up, and it varies if you've been receiving Social Security benefits or railroad retirement. You'll get your card automatically. Otherwise, if you are starting Medicare, then you will need to actually apply, and you can do that in one of three ways. All through Social Security, and you can apply for Medicare and your Social Security benefits, or just Medicare by itself. You can do that online, in person, or over the phone, all with Social Security. The information's there on the screen as far as how to do that. So jumping into the four parts of Medicare, all these different letters, I know it can be overwhelming, but I'll kind of talk you through it so that way you can make it a little bit easier. A and B is original Medicare. Part D is the drug coverage, or there's those all-in-one things called Medicare Advantage, which is Part C. Part A, this is hospital only. Most people do not pay a premium. Keys here on the right-hand side as far as your costs. This would be if you just had original Medicare. These would be your responsibility without getting any help. Otherwise, Medicare would help out after that. So you can see you have a $1,408 deductible. It's unique though because it's a per period. It's good for 60 days. So if you go into the hospital and then come out on day 61, you'd have to pay that over again. Then there's the copays, as you can see below that, depending on if you've been in the hospital or a skilled nursing facility, where those are going to be your responsibility. Part B is the second part of original Medicare. Most people in 2020 are going to pay an extra premium of $144.60 a month for this. In addition to that premium, you will have to pay a deductible if you use your Medicare insurance of $198 for any non-preventive work. So you'd have to pay that first, and then Medicare Part B will kick in, and it'll pay 80%, and you'd have to pay 20%. One of the big differences is that most plans that people have had before, even if it's an 80-20 plan like this, they have some kind of cap. So once you hit that cap, maximum out of pocket, you'd be all done, and the insurance company would pay 100%. Medicare does not have that. There is no cap. So what can you do about that? Here in Wisconsin, one of the options is to add a Medicare supplement. Medicare supplements are standardized. There's 30-some companies that offer different plans. The coverage is the same because they are all standardized. The difference is the price that you're going to pay for that. So what are some of the benefits? You can kind of see here on the screen. They all have the same base policy, but then you can add a rider, which is an additional coverage for extra premium to basically increase your coverage to make it more comprehensive. So there's a number of ways you can tailor that depending on what's important to you. This is a comparison. I was working with someone earlier in the year and ran through some quotes for them to give them a truly apples to apples comparison, because again, Medicare supplements are standardized. These are the exact same coverage, but you could see here the monthly premium varies quite a bit. In some cases, almost double for the exact same thing. You're not getting any different doctors or hospitals or more coverage or less coverage. Literally all the same. Only difference is the premium and the logo on that ID card. Medicare Part A, Part B, and a supplement do not cover prescription medications. So that's where Part D, which is Medicare prescription drug plans, come in. There are several insurance companies that offer these. Plans do vary based off of if you have certain pharmacies you want to be able to use, the premium that you pay, but also the copays that you'd pay for certain medications, and even sometimes the medications that are covered will vary from plan to plan. So that's where it's helpful to be able to go through and look at what's important to you have covered and narrow that down to find the value that way you're not overpaying. So brings us to our first option that people on Medicare have, which is going to be sticking with original Medicare. So you're paying that $144 a month and 60 cents for Medicare Part B, and then adding in the most comprehensive Medicare supplement. Competitive rate for most people is going to be about $140. You can spend quite a bit more than that. Sometimes there's a little bit less, but as a ballpark starting range, it's a good number, good starting number. And then I say about $30 a month for prescription drug. That's about the national average. As it's an average, some plans are lower, some are higher, but it gives us a starting point. So you're looking at about $315 a month. It's going to give you really nice coverage as far as you can go to any doctor, any hospital. You don't need a referral. There is going to be that deductible for anyone starting Medicare in 2020 or later of $198. After that, basically, if Medicare covers it, the supplement will help fill in the gaps. You have your prescription drug coverage. You might have some additional copays for medications, but it's really, really comprehensive coverage. And you can go to any doctor, any hospital that accepts Medicare, not only in Wisconsin, but nationwide. The other option is Part C, which is also known as Medicare Advantage. And this has been a popular option. Here in Wisconsin, about 41% of people on Medicare have a Medicare Advantage plan. So it's the reasons why vary from person to person, but they have been very popular. This works very differently because what happens is you're getting your Medicare benefits from an insurance company instead of the government. Usually they're all in one. You might see the commercials in the fall. That's the big season for promoting these plans, but they're the all-in-one where they bundle everything into one, usually include prescription drug coverage. They do use a network typically, so which means there's certain doctors and hospitals that you're restricted to go see. If you go outside of that network, you may not have any coverage. So that's one of the drawbacks. One of the pros is the premium is going to be typically much lower compared with that first option. And then they might include some extra benefits. Dental, vision would be common ones. These do vary by plan, so they're not with everyone, but they can be included in some. And if you have a really poor year health-wise, they do have a maximum out of pocket, unlike traditional Medicare. So here's a quick look at that. You still have to pay that Part B premium, $144.60 a month. And then the Medicare Advantage plan you choose could have an additional premium. Some of them are $0 a month. Some of them are quite a bit more. That's going to vary. That's something we can talk about if you're interested in this route. And then they typically have copays, where if you go see your primary care doctor, you'll have an extra cost as you go. See a specialist might be a little bit more, emergency room, and all of these costs add up. And if you have a really poor year health-wise, you hit that maximum out of pocket, then your copay stop, and the insurance company pays 100% for the rest of the year, with the exception of prescription drugs. So you can see your monthly premium could be as low as $144.60 a month, which is quite a bit less than the first option. That's one of the key potentials. I tell people, though, going this route, you do need to be willing to be a little bit more flexible because you're restricting yourself to a network, and it is possible for the plans to change from year to year, unlike the supplements where that coverage is going to stay the same. That's kind of what I'm noting here, where this is from the Wisconsin Guide to Medicare. Medicare Advantage plans can change or even terminate from year to year. It's not, I wouldn't say it's common, but it is possible. So some of the key points of these two options are, for the first one, with that original Medicare Supplement Part D, you can go to any doctor, any hospital except Medicare. You do not need a referral. So if you want to go see a specialist, you go right to that specialist. It is higher premiums, though, compared with the Medicare Advantage. So you're paying that premium whether you're using the plan or not. That's some people will like the lower premium and more of that pay as you go. That way you're paying for something that you're actually using. That being said, when you do use the plan, it is, if you're paying or using it as an Advantage plan, it is possible to have more copays, because some of these maximum out of pockets can go as high as $6,700 per year. Working with me, I'm an independent agent. I've been licensed for more than 10 years. I work for you, not an insurance company. That's why I'm independent. So I get paid from an insurance company. They all pay about the same, so I'm not biased as far as compensation for one way or another. But I do have an incentive to sell companies that provide good service, both for you and for me. That way, it makes all of our lives easier. Key thing is you do not pay extra for me. I don't charge you a service fee or anything like that. And the policy that you sign up for is the exact same price, whether you sign up direct with the company, use an agent like myself, or sign up in any other method. Pros that are, you can call me with questions, not some person sitting who knows where in a 1-800 call center. I'm right here in Wisconsin. So you can call me. I'm going to know your situation a lot better than someone that you're talking to for the very first time. I can also help you shop now as you're going through this, which can be overwhelming, but also in the future help make it easier, because a lot of people end up changing their plans. It's not like they're a once and done decision for Medicare for most people. Speaking of signing up, the enrollment periods. So if you're starting Medicare, you have a 7-month window around the time that you turn 65 to sign up for Medicare. After that, if you want to change your plans, there's the annual enrollment period, which happens every year from October 15th to December 7th. And that's a good time as far as switching your prescription drug plans or Medicare Advantage plan, where it'll take effect January 1st. Outside of those, you typically need a special election period to make a plan change. And that's where there are quite a few different options. If you think you might have one of those, or if you're just curious, call me. We can see, because they do vary by very individual people, situations, and limited time periods. Key question that comes up is, can I change my plan later? So if you choose a Medicare supplement and you decide later you want to switch to a different Medicare supplement, after that first 6-month window of being on Medicare, then if you want to switch to a different supplement, you'd have to answer health questions and pass an underwriting review. You can do this any time of the year as far as switching, as long as you can pass the underwriting review from that new company. All these companies underwrite differently, so one might not accept you, but another one might, and that's where I can kind of help out to make that easier, shorter process for you. If you want to switch to an Advantage plan, then you can do that with very limited underwriting during the annual enrollment period, October 15th to December 7th. If you choose a Medicare Advantage plan, generally you can switch to a different Medicare Advantage plan during that annual enrollment period. Or if you want to switch to a supplement, you can do so during the annual enrollment period, but you still have to pass that underwriting review. What's not covered by Medicare? Many people are surprised to see Medicare doesn't cover everything. So some of the things are dental, vision, long-term care is another one that people are surprised about. So if you have questions on these, let me know. I'm going to talk one-on-one as far as your situation, if some additional coverage makes sense. Here's how you can do that. Again, my name, Mike Lovell, phone number 608-571-4461. Email is mike@askmedicaremike.com. I'm in the greater Madison area, but I help people all over the state of Wisconsin. So if you have questions, please reach out. I'd love to help you.